HPV informational presentation. What is human papillomavirus, or HPV? HPV is a virus that can be transmitted through sexual contact, both penetrative as well as skin to skin. Over 120 strains or versions of this virus have been identified, with different strains having different potential complications after infection. Of these strains, approximately 80 will lead to warts on the skin, most commonly on the hands and feet. Around 15 strains have been linked to cancer, and these strains are further divided into low-risk and high-risk categories. The most notable of the high-risk strains are 16, 18, 31, and 45, the strains that are most often identified in cases where HPV has induced precancer or cancer. This virus is able to incorporate itself into the DNA, or genetic material, of humans, which allows HPV to create potentially cancerous changes in our bodies. This virus is linked to an overwhelming amount of cervical cancer cases, as well as cancer of the labia, which is the area outside of the vagina, penis, anus, mouth, and throat. Though a majority of cases of HPV are without symptoms, long-term infection can pose serious health risks. So why should you care about HPV? Of all sexually active people, greater than 7 in 10 will contract HPV at least once in their life. While many of these infections will be asymptomatic, meaning a person never knows that they have HPV because nothing appears to be wrong or changed, if the body does not appropriately fight the infection, HPV can be very dangerous. Because of the location of the types of cancers HPV causes, especially cervical cancer, people often do not know that they have cancer until the cancer has spread. Of all HPV-related cancers, cervical cancer is far and away the most common type. Cervical cancer ranks fourth in the world of cancers affecting women, and it is estimated that nearly 500,000 women a year will die from cervical cancer. How do we protect against HPV? Due to the overwhelming number of people affected by HPV and its potential complications, a way to address this infection was developed. In the United States, the first generation of the Gardasil vaccine, which is called the 4V HPV, was approved in 2006, and the 9-strain vaccine was approved in 2016. This vaccine protects against high-risk and low-risk strains of HPV. Vaccination with Gardasil can start as early as 9 years old, though many children receive the vaccine beginning at age 11 or 12. The second dose of the vaccine is then administered 6 to 12 months afterwards, protecting the recipient extremely effectively. In previous studies, the Gardasil vaccine was found to be effective in 9 out of 10 children, with a better chance of working among 9 to 14-year-olds. This finding indicates that the younger the individual is at the age of vaccination, the more effective the vaccine will be at preventing complications of persistent HPV infection. What are common myths about the Gardasil vaccine? Misconception number 1. Vaccinating my child will encourage them to engage in sexual activity. There is no data to support the claim that vaccinating children against HPV will encourage sexual behavior. Additionally, if one's child had sex with only one person their entire life, their partner may have had sex with more than one person. Both men and women can contract HPV from intercourse, even after marriage. Misconception number 2. Only girls should be vaccinated with the Gardasil vaccine. Though cervical cancer is the most common cancer resulting from HPV infection, there are several other types of cancers that are caused by HPV. Not only can men and women suffer from cancers of the mouth and throat, men are also susceptible to penile cancer from HPV infection. Additionally, vaccination in males can prevent spread to females. Misconception number 3. The Gardasil vaccine is new science and is therefore unsafe because the side effects cannot be known. This vaccine was approved in 2006, but was researched for decades prior, Though social media and personal anecdotes provide negative or concerning information about the effects after Gardasil vaccination, the only side effects documented in extensive research are mild reactions. Where can my child receive the Gardasil vaccine? The Arkansas Department of Health here in Little Rock offers the vaccine to children 18 years and younger who are uninsured or underinsured. The address is listed here if needed, as well as the phone number. They are open Monday through Friday, 8 a.m. to 4:30 p.m. County health departments here in Arkansas often offer free Gardasil vaccines for children 18 years and younger. See your county's health department website or call the number listed for more information. What are the signs and symptoms of cervical cancer? Cervical cancer is often asymptomatic, but can cause symptoms such as bleeding after sexual intercourse, pain with sex, or difficulty with urination. Because cervical cancer is often asymptomatic, this allows it to spread unnoticed if one does not receive regular screenings. Because of the nature of cervical cancer and the fact that it can affect women at much younger ages than the quote-unquote typical age range of cancer, it was imperative to develop a way to screen for cervical cancer, which is why the pap smear was invented. How do we screen for cervical cancer? Regular pap testing, or pap smears, screenings are considered the gold standard for cervical cancer screening. A pap smear is conducted during a speculum exam, which is an instrument that is inserted into the vagina to see the cervix, and toothbrushes are used to collect cervical cell samples. These samples are evaluated by pathology or cytology, which then will identify abnormalities in the cells, if present, and can additionally test for the presence of HPV. If abnormal cells or HPV are detected, surgical options are used to remove the lesion. Recommendations currently are that women receive pap smears beginning at age 21 and continue every 3 years. At ages 30 to 65, there are several screening options available. Women can opt to have cytology alone every 3 years, as they did ages 21 through 29. Women can choose to have primary HPV testing every 5 years, or women can choose to do cytology with HPV co-testing every 5 years. All 3 options are appropriate and all require speculum exams and sample collection with brush. The earlier precancer and cancer is found, the better the chance one can be effectively treated to prevent the spread of cancer. Resources for cervical cancer screening. They are offered here at 12th Street Health and Wellness Center Women's Health Night. Additionally, Arkansas Breast Care Program offers pap screening for uninsured women.